You are listening to the Health for All podcast, and this is your host, Sanat Kumar. I hope you enjoy listening. Welcome to all the listeners of the Health for All podcast. Today, I'm actually super thrilled. I'm excited, not just because it's a topic of interest, but it's also a person that I've been wanting to talk to for a long time now. Who I have right now on the show is Pak Setiaji. A very warm welcome to you, Pak Setiaji. Pak Setiaji is a senior digital leader. He's driving some of the most critical digital transformations in the health space in Indonesia. A large part of his career, he's played an important role in providing effective solutions that have an immediate impact and contribute to improving specifically public services. He's currently the Chief Digital Transformation Officer at the Ministry of Health. And all of the stories we hear about and the good things that we're hearing about, specifically with regard to the digital transformation that's happening at the Ministry of Health, the man behind that is nobody else but Pak Setiaji. Pak Setiaji, a very, very warm welcome. I'm excited to talk to you for the next 45 to 60 minutes.
Thank you, Sir Sanat. Thank you for the time. Yeah, also interesting about our journey, especially how we can transform the digital healthcare in Indonesia after COVID.
Wonderful, Pa. Absolutely. And you have been, I think, in the middle of toughest times in the world with the Ministry of Health, building one of the most important solutions. Most recently, you were recognized as the top 100 CIOs by CIO.com. A big congratulations to that. As part of your current role, you are driving digital transformation for the Ministry of Health. You are a recipient of a number of different awards. Before we even jump into everything that you're doing in the Ministry of Health and in DTO, walk me through your journey, Pa. How did your career start? Where do you come from? Tell me all the things that make Pa Setiaji who he is.
First of all, I think I need to say thanks again. Yeah, 2 weeks ago, I got new awards from the CIO. A long journey to develop a digitalization in Indonesia. I start from the local governments. Actually, I am the civil servant or the government employee and joined the government around 1998. Yeah. When was that time is a crisis. Yeah. And then I start to develop the digitalization in that sector. I was in the Jakarta before moved to the West Java province. I was ahead of Jakarta Smart City.
Got it.
The governor asked me to develop the new initiative digitalization in Jakarta. So we developed the Jakarta Smart City. Actually, this is more wide, from the health sector, because when we talk about the smart city, not only we develop the smart health, but also smart education, etc. And then at that year, I almost 4 years. Actually, we developed a new team like DTO now from the professionals. Because if we just only rely with the government employee, we can run fast. We need to upgrade first, and then we need to reform about how they think and how they do. And now maybe you know about the agile development as well.
Yes.
Because of that, we set up a new team, and then after finish, the governor of West Java province asked me to join. Actually, I promoted from the last position to this position. So I lead Jawa Barat or West Java province. He gave me some responsible to lead the agencies digital. Maybe in Indonesia we always known Dinas Kominfo. Dinas Kominfo, it's been ICT agency in the West Java province. Yeah, actually, it's a very different situation from the Jakarta before, because Jakarta only have 10 million people. And then in West Java, we have more than 49 million people. So this is 5 times more big compared with Jakarta.
And this is after you developed the smart city, you went to, yes, got it.
Yes, he asked me to join, and I joined, and I developed more focus about the digitalization in rural area. So because of that, I developed what we call the smart villages. And then we, with the 27 regional or local city and agencies together to build this system.
Okay, and how many villages approximately?
Actually, in the West Java, we have more than 3,000. So we develop like common centers, then also encourage the ecosystem together with us to run this initiative. And then the other thing, we set up also the team like a smart city. So the second time I set up the team, we call this West Java Digital Services.
Got it.
Actually, the idea is come from not only from the UK. UK have a government digital services. Also from the Singapore, they have a GovTech. And then from US, they have a USGS. So we did the same way to set up the new team to accelerate our digital journey in the West Java. And then COVID arrived.
Yes.
We with my team develop application like PeduliLindungi.
Yeah.
Actually, this is the COVID app. We integrated all of data came from others agencies.
Yeah.
And then we call this Pico Bar. And then with Pico Bar, our minister Budi saw, this is the success way how we manage the COVID-19. Using the coordination application and also integrated the data into this application. And then with this initiative, so we can show in the command centers, we can show in the application for the public how the current situation in the COVID. Yeah, because of that, Minister Budi asked me to join. Actually, this is very difficult. When I first got the offering from the minister, I need think more than 1 month before.
So I just want to pause there. So how was that conversation with Babudi, right? When you actually, when he approached you and asked you to drive one of the most important agendas for the country, because the app was not there. We were still trying to build something. We were trying to take all the learnings from everywhere in the world. And you, of course, had successfully done something in the smart city, smart villages. Walk me through that conversation. How was that conversation with Babudi?
Yeah, actually, I think he is the best. The best negotiation.
Yes, absolutely.
And maybe I need to simplify conversation. He said in the home office. He said, you know how many people died? When the COVID. He said more than 400 until 500 people died every day.
Yeah.
And then he said to me, if you still longer time to think, it's many people died.
Yeah, that's very powerful. That's very powerful.
Yes. After this, he's make me. I think I need to because he believed me. So I think this is not only the challenge, but I think I can in bahasa dia bisa membuat saya berubah kemanusiaan ya. Kemanusiaan very important thing. And then because he believe I can make it more change if I join with the Minister of Health, not only COVID but also others related after pandemic. I can make more bigger if I just only in the city level or province level. Can convince me about that. Not only about the kemanusiaan, about the peoples, but also you can do more bigger if you can join with us like that.
Got it. Got it. So what he basically said is, if you really want to transform the country, you have to move away from the provinces and come to something that is more elevated, where you can
Yes,
see a larger impact of what you do, not
yeah,
just for
yeah,
the human, for the country as a whole, right?
yes, exactly like
Yeah,
that.
yeah, that's amazing.
Yes,
So that was your conversation, and then after that, the rest is history.
actually, I still have a double job
Hmm.
before, not only in province but also in the national. Yeah,
Hmm.
I do both because also give some permit from our governors.
Hmm.
So we
Hmm.
need to divide, yeah,
Hmm. Hmm.
our capacity and also our minds and also our job to this not only national but also in the local.
Hmm.
Our
Hmm.
governor Pak Ridwan Kamil said, okay, I give you 70-30%,
Hmm.
70 for the
Hmm.
profits and then 30% for the national. But
Hmm.
in fact, opposite. So
Hmm.
I
Hmm.
I
Hmm.
give the 70% for the national, but 30% for the province level. Yeah, because of the two peoples give me believing, yeah, about that.
Wonderful. The application that really caught the hot seat and the news, the press, PeduliLindungi. It had about 100 million plus
Yeah.
users. Tell me, how was this app developed? What was the collaboration that this app went through? How much time did it take to actually develop the app?
PeduliLindungi is an app that was developed by the government of Indonesia, collaboration between Ministry of State-owned Enterprise
Hmm.
and also Ministry of Communication Informatics and
Hmm.
Ministry of.
Hmm.
Before
Hmm.
PeduliLindungi, many protests, many complaints
Hmm.
from our citizen. Yeah.
Okay. Okay.
And then the other thing is track
Yeah.
every movement of the people.
Correct. Correct.
Because of that, when I joined, we set up the team DTO. DTO is our the third baby for the
Hmm.
digital
Hmm.
team,
Hmm.
and we transfer from the Ministry of State Enterprise and the Ministry of ICT into
Hmm.
the Ministry of Health. We
Got it.
start to develop and add more and more features based
Hmm.
on
Hmm. Hmm.
testing, treatment needed, and etc.
Hmm.
The
Hmm.
important thing is when PeduliLindungi become powerful because we integrated with the COVID test
Yes,
and then
and
also the
the vaccine
vaccine,
certificates.
and then the others startup. Yeah, yeah. So we add more features in
Hmm.
July and August 2021.
Hmm.
From check-in features, we start from the mall and
Hmm.
then move to the airport, and then
Hmm.
also to integrated with the train,
Hmm. Hmm.
and then
Hmm.
also with the telemedicine. And then
Hmm.
we changed the Peduli Lindungi. Actually, Peduli Lindungi, we every weeks we upgraded the Peduli Lindungi because what?
Yeah,
Yeah, because we concerned about the people complain about
correct.
the how we can improve the this
Correct.
Peduli Lindungi.
Yeah, because I
And
did observe from the very first time when I got my vaccination, right, in Chilandak, I got a vaccination and they said, no, just download PeduliLindungi. You will be able to, see your vaccine certificate after 24 hours. And there was always skepticism, right? Oh, will I see it? What if I don't see it? I remember they gave me a small slip with the contact number. They said, you definitely will see it in 24 hours. And I was amazed that not even 24 hours, in 4 to 5 hours, I was able to see my
yeah,
certificate, my wife's certificate, and my son's certificate, which was pretty amazing. So kudos to the agility with which you've built this. So
yeah.
what do you think differentiated this app from the rest of the apps that are there in the market across the globe?
Actually, the main idea from the Peduli Lindungi is coming from Singapore. They have test together.
Mm,
Actually, in the first time we built mostly same with the test together, but
mm,
we
mm,
improve our application. We add more features like
mm,
COVID test and
mm,
also vaccine certificate. and then vaccination color status, to make sure the people who enters the public area eligible to enter, and then to make our people more healthy in this area. The important thing is about the colors. When at the time the screening result is black, when someone is positive COVID, and then red of a high risk group or haven't received any COVID-19 vaccination, etc. The more user used it. We also share our data to the, for example, to the train station. So if you want to if you want to buy some ticket, for example, the train ticket, so the system will check you eligible or not, you are COVID
based
or not,
based on your
yes,
app
based
status.
on apps. And that's the other thing. We also share the data to the more than 100 different applications, not only coming from the head. For example, like Imani, from the transport application like Gojek, etc.
Now, how difficult was the data integration part of it? Because that must have been a nightmare, right? Because there is no single source of truth in Indonesia. And right now, when you go to PeduliLindungi, almost, I would say 80 to 90% who are vaccinated have their certificates on that application now. So you have to get the NIC numbers. You want to make sure the NIC numbers are validated, their IDs are validated, plus the certificates also are validated. I would say it's almost 100% accurate, right? How did you get to that level of accuracy?
First, we integrated with the Dukcapil. Dukcapil is Ministry Home Affairs. It's from the Home Affairs to get the citizen ID. So we got the citizen ID came from that system. And then also we improve our system capacity. Before, maybe 100,000 every day for the cases can be recorded by a system. So we improve our system because we need more than 5 minutes to input one people to our system. This is we call this new all record. And then so we improve the system, not only integrated within the citizen ID, so we can save more than 9 fields if we can connect with the citizen ID data. And then also we have more than 45 fields need to input. So we simplification into 10 fields. And then after this, only 30 seconds.
So from 5 minutes to 30 seconds.
Yes. And then the other thing, we also integrated within the lab, already have system. So the lab no need to input twice. And then also we connect with the others province, the biggest province, the West Java, Jakarta, Semarang, Bali, etc. Because I was before in the province level, so I know the burden about that. So we integrated actually within this system. This is, I think, the powerful when we integrated, believe about the data coming from the system.
Amazing. But that's why I think not just the people who live in Indonesia understand the power of this app right now, but also I think it's been recognized everywhere globally as an extremely powerful app that has supported the citizens and the country during the pandemic. Taking a slight segue into a different agenda, because you're driving so many things as part of a DTO. You're also looking at the next big venture, which is a Satu Sehat platform, where it provides connectivity, analysis, data services support to integrate various health service applications in Indonesia. So many countries trying to do this. They're trying to get their records together. They're trying to make sure that there is one single uniform way of looking at health records, single citizen ID. But going by all of your success that you have launched and scaled, just for our listeners, so what is the vision, what is the goal of the platform, how far are you at, if you can talk us through that?
We can learn more from the COVID-19. Actually, our minister gave us two tasks. First, how we can handle COVID, and then already successful, and then the second thing is about how we can do a big change digital transformation in the healthcare sector. We have many issues. We have more than 400 applications developed by the Ministry of Health and also other regions.
Yeah,
you can imagine how burden the health workers to input numerous applications to just report it. The important things also we change not only our mindset before to reporting into the what we call the improve the services. Because if we improve the services, we can simplify the application. Using what? For medical record. I think medical record is a power. Power, we got the data, we got data from different cases, etc. Because of that, we change our mindset and not to develop again the application for reporting, but to improve the system in the hospital, lab, etc. And then the important thing is the next is how we can integrate it, all of the health record coming from the each health facility. Then we build the platform Satu Sehat. Platform Satu Sehat is mean like a health information exchange. Then in this platform we provide not only the standard but also the standard the terminologies of the health. And then for the terminologies we also using the like ICD-10, ICD-9 and login. And then also for the transfer data image, we're using the DICOM. So we put on that side. From the health facility need to comply with our standard.
Got it.
And then to support this initiative, so we launched the new regulation from the Ministry of Degree of Health of number 24. We give we put these roles. The health facility need to digitalize using the personal medical record, and then need to integrate it with the Ministry of Health until December 2023.
Okay, got it. Where are you in terms of building all of these standards?
Yeah, we already. All
the standards are ready. Got it.
Yeah, because we just put the standards that came from others international standard. For example, ICD-10 already have, but other standard we built from our team. For example, the dictionary of medicine, and also medical devices. So we built with our because not have international standard, very different with the others.
Got it. Are you following some kind of a UNSPC coding for each of these? You're following. Correct. I can totally imagine the effort going behind for this country, because when we do it for one or two clients, we understand what the complex nature of this is, and now you're doing this at a scale for the country, which is great, because then the whole country is able to look at data with one single lens, right? So you're standardizing, you're asking hospitals to comply, and I'm guessing this is private, public, all medical institutions, right? Primary care, secondary care, etc. Right. It's a pretty massive undertaking. 60,000 health facilities, the 3,000 hospitals, right? And with you have about 600 trillion in healthcare spend right now, so it's only growing, right? And so how close are you to that? To that 60,000? Where are we at in that number?
Actually, many people thought me this is very ambitious, ambitious target, etc. But we believe if we with the ecosystem, because of that we built the open platform to startup vendors. They can build these applications and then they can offer the system to the hospital. Rather than Ministry of Health build their own application to the hospital, etc. So we have arming now. From the startup, from the vendors, etc. So actually now already integrated with us more than 8,000.
8,000 already fully integrated.
After 3 months,
excellent.
We do and accelerate this system. We focus now in the Jawa Bali first. Java.
Got it.
And Bali first. And next year we focus on the side of Jawa Bali.
Excellent. And I mean, that's phenomenal that you've already been able to achieve 8,000 in a span of 3 months. Obviously, this takes a team behind this. It takes a lot of hard work. It takes a lot of training on the ground, right? How big is this team that is driving this change?
Yeah. The team itself established on March 2021. We start from the small team, from the 5 people, and now more bigger, more than 200 people.
Wow.
More than 200 people with a majority background in technology. I hijacked the professional from the startup to the system.
I recently saw the hashtag going viral, no? Hashtag hijack. so hijack from startup, but that's great. So are you seeing a lot of youngsters with the right digital skills now aspiring to want to work for DTO? Tell me a little bit about that. How are you seeing that change? Because you move from 5 people to 200 people, and that will take a lot of good talent also coming in. Right.
Yeah, actually we start from the key person first. Yeah, we choose first the top level, for example, like a CTO, CDO, and then after they join, we ask team. Yeah, we ask the top level also to ask their team before. Yeah. So we take the main peoples, to encourage the other team when they join. Yeah. Actually, this is
what is it that that is your, if I may, the quotient that you use to attract the talent? Because of course, startups are exciting, agile, right? They're also paid a lot, right? And they get to be a lot more global, etc. I know with DTO, of course, comes serving the country. What is it that brings them close to DTO and want to work for you?
Yeah, actually, this is not only matters of the paying. About the salary, etc. Because many people, young talents, want to join the government because they want to do more bigger, rather than in their own company. They are already succeed in the company, but they do nothing for the people. So I ask many people to join. If you join with us, you can build some bigger changes. If you just play with the private company. And as many people, also many young talents, also they can actually they agree to decreasing their salary before it. Because
That's
the idealism of that.
That's right. It looks like Pabudi's line to you when you were joining him is a similar line that you
actually we do the same.
Right. I think DTO is one of those organizations within the government that is agile, that is forward looking, that's looking at transforming the country and putting Indonesia on the global map. And you're successfully showing that track record. But it always comes with challenges, right, Pak Setiaji? What are some of the challenges that you potentially are foreseeing?
This is about the time, because as you know, in the government, they always change every 5 years. Because of that, we need to accelerate this team before change leaders. Our ministers coming from where? Not from the doctor, but from the nuclear physician. The time is relative. He always said that. So many issues need to improve and parallel with us. Because of that, we need more team, more collaboration. And then the other thing is about the talent itself. When I developed the digital transformation office, our government employee need to improve their capacity. We also putting together with our team from the government employee. So how they improve is very challenging. And then the other thing is about the infrastructures. I mean the internet access, etc. is also important for us to improve their capacity. But we already have like some cooperation with the ICT to accelerate our digital capacity, not only our team but also the head workers. I think last month we already give like webinars to the head workers, more than 10,000. We with the ICT department to build the awareness about the ICT.
Wonderful. And this will also not just be tier one, it'll be tier two, tier three cities and the whole of the country, right?
Yep.
And there is a need for local related learning, development, socialization. Kearney did a study with AJWC. This was to understand the digital future and digital penetration of tier two and tier three cities. And there are innate challenges for adoption, right? Hesitance to use online application, cultural related barriers, and then religious leaders are not very supportive of some of these transformations. Are those also some of those challenges that you are trying to address at a grassroots level?
Yeah, yeah. Actually, in the grassroots level, we work with closely with some community organizations. For example, in West Java, we have more than 1,000 volunteers, IT volunteers. We call this in Bahasa Relawan IT. We do this initiative actually when I was in West Java, to building the capacity from its citizens, for digital literacy. I mean, so we can together with them. And then the other thing, we work closely with the startup. For example, some startup sometimes they closely with the religions leaders, so they can together with us to convince this initiative. And if we can work closely with others, community, startup, etc., the issue what we face can be light.
Wonderful, Pa. And IT transformers or change agents, are they working only with the Ministry of Health, or are they also working with other agendas for digital transformation for the country?
Yes. So not only in Ministry of Health, but also from the ICT department in the central government, but also in province level.
Got it.
Province level, they have ICT agencies.
Got it.
Because before from the ICT agency, so I also work closely with them to build not only the capacity for the people, but also the infrastructures. And then we also work with the Ministry of ICT to spread more infrastructures access in the rural area.
So, Pak Setiaji, we have PeduliLindungi, we have Satu Sehat, right? And now PeduliLindungi, of course, people are scanning, and I myself scan everywhere I go. But slowly, as we see, the pandemic is slowly disappearing. It's becoming an endemic. The traffic on many apps are coming down, right? And of course, you probably are facing exactly the same thing with your application as well. How are you addressing that? Because once they're gone, it's very difficult to get them back on the app. Right? So what is it that you're doing? I know you and I spoke in our previous conversation a little bit about what we need to do, but what is your perspective, Pa?
We transform the COVID apps into what we call not just COVID. We call this citizen health app. We still use the same infrastructure, same application, but we build more features in this application. So the people no need download again. They can just use this application. We learn from others country. Some country already built like a citizen health app, but not many people use this application. Maybe only 30% use this for online registration. Because of that, we are thinking about how we can build the applications not only more easy, but we put some gamification on top of the application itself. Example, we can put some reward incentive if you can walk every day 5,000 steps. Actually, now we already discussed and developed these features to connect within the 3 biggest vendors smartwatch in Indonesia.
That's wonderful.
And then we integrated this system into our new PeduliLindungi. Then we also talk with others parties like big pharmacies, big hotel, etc., to give the reward to the people to change their behavior. And then with this initiative, we can do also changing behavior from people rather than curative into the promotive prevention.
Got
And
it.
then the other time is actually the new PeduliLindungi is like a personalized app. So they have the diary, the personal diary, and then they can get the information just only if they have a new, I mean, like a Netflix, yeah. You have like a recommendation before because your favorite movie like Korean,
Yeah.
like
Yeah.
horror and stuff.
Yeah.
And then in our new PeduliLindungi, actually we just only view the information. For example, like if you got the diabetic, so
Yeah.
we put the information diabetes, not all
Got
the
it.
information for them. So it's
Got it.
more
Personalized information, right?
yeah.
Sharing with them.
And then the other time is we connect within others system.
Just to go one step deeper into this, right?
Yeah.
See, because there you are integrating with many different apps, right?
Yeah.
Now, let's say I have a Hello Doc that is integrated with the PeduliLindungi app, right? Now, how do I ensure that I go on to PeduliLindungi to make my transaction versus go to Hello Doc to make my transaction, right? How are you thinking about that? Because now you're connecting them to smartwatch, you're connecting it to bank, you're connecting it to vendors, you're connecting it to multiple different various to where you're able to see a patient's or a citizen's life and his health end to end, right? So what is that anchor that you're using to ensure that he's using the PeduliLindungi app first instead of all the other apps?
But the thing is, many people can use our data, yeah, and then many people track more data coming from other system.
Got it.
Because of that, our focus is actually the numbers of download, the numbers of not very important. The important thing is how many data can use with our system, yeah, using our data produced by this application. Yeah, and then the other thing is the benefit for example, like HaloDoc, because they can access the citizen medical record came from other facility, so they will join with us. And then the next, actually, we will run a sandbox regulatory. This is very important thing to make sure the innovation, vendor, etc., comply within the privacy, clinician, standardization, etc. After they pass our review, so they can get like a license from us. This is like a fintech.
Got it. Got it. No, that's very powerful because that's where I was getting to in terms of when you're offering a personalized solution. Let's say if I have hypertension, right? My medical records in your application have already been stored, let's say from a Prodia lab, and it's already been stored in your application. And you have a background script that actually can read my report and say that, yes, I'm a hypertension patient. This is my typical ranges of hypertension. And when you are giving me personalized advertisement, right, whether it's for vitamins, supplements, way of life, doctor recommendations, all of that, what is the data security behind that part? Because that is something that is almost like a gray area. What is ethical? What is not ethical? How are we differentiating that? And how do we make sure that me as a patient, I'm comfortable with the fact that there are so many different applications in the background. They're all able to read my records, my personal data right now. So where are you maintaining that balance and how are you making sure that the user is confident?
Yeah, actually in our platform, we built like consent rules. Consent rules. So there are some governance for the data access using the consent. For example, like AIDS. AIDS, very sensitive data.
Yes.
So only the right doctors can access this data. So we put in our consent rules, these doctors, the background specialists for the AIDS can access this data. Even the people go to others hospital, Usually, when we go to the other hospital, we offer our data into the hospital. But in the system, we can make a rules. Only this doctor can access. Other doctors cannot access. Yeah, this is like what we need to do in this. And then also, we not only in terms of that, we can check when for example, like application like HaloDoc, etc., put in our sandbox regulatory, so we can check about the data privacy, the access or not. Because of that, very important thing is combining within the concern rules and also sandbox regulatory. This is work or not when the all many parties join with us. Very important thing to do like test bed, yeah. To make sure. Yeah.
You recently also had a regulatory sandbox conference and learning session where you're actually building the blueprint and the future of this one. Where I'd like to kind of wrap up this conversation is it's an inspiring journey that you've had, right?
Yeah.
You've started at the grassroots. You've shown change in provinces. Now you're able to show change in the country level, and you've put Indonesia in the world map, in the global map for digital transformation. There is, of course, the vision of making this happen by 2024. I've read your detailed document and PDF as well on the 2024 vision, right?
Yeah.
And in my personal opinion, I think it's going to be a grand success. But I want to hear you out. What is your vision for 2024, and what would you call as success, right? At the end of 2024, if somebody were to say, Pak Setiaji, was this project a success or not? In a few sentences, if you can tell me, what do you define that as DTO success for 2024?
Yeah, the successful of this program not only a big impact for the people, but the other thing is we need to make sure continuing sustainability of this program. Because of that, here we will launch others roadmap in from 2024 until 2029 to make sure the journey still continues.
The sustained journey.
Yes, yes, this is one thing. And then the other thing is about actually not only comply but also achieve the target from minister to connect within the 60,000 health facility, and then to build the capacity, etc. And then the other thing is how we can use this data from coming from other system to improve the health facility, the financing, for example, national health account, etc. Actually, we can develop many things in after we collect the data, for example, AI and etc. This is the important thing, how we can use and get benefit from this data.
Wonderful. A ground up story that you have painted for all of us. I'm sure the listeners, whether they are young enthusiasts trying to get into digital transformation for the country, or investors, or even startups in this space, you're one organization to keep a constant watch at for everything that you're doing. So, I'd request all my listeners to follow DTO and follow Pak Setiaji on the amazing work that you guys are doing. So, thank you so much, Pa, again, and thank you for making the time.
Thank you, Sanat. Thank you.